I'm joined now live from Washington by Christina Bellantoni, senior reporter for Talking Points Memo. Another good morning to you, Christina.
Hi, Alex.
Let's get to the president's approval rating hovering near about 50%. Now, Gallup says this is not statistically significant. However, symbolically speaking, it is a development. How does this affect the president's agenda, if at all?
Well, obviously, the president would prefer being mostly popular with the American people, but the White House talks about this a lot. They say they don't pay attention to the everyday ups and downs in polls. Of course, they do cite the ones that make them look good, but this is obviously going to happen. He came into office with astronomical popularity after winning the election in 2008, and his approval ratings were at all-time highs after the inauguration. It was always going to come down, but I think part of this is the American people are concerned about the economy, but also they've seen that his agenda has become stalled in part because of what's happening on Capitol Hill. If health care reform passes, the president is probably going to see an uptick in those approval ratings.
Okay. What about the unemployment drag, though, on his approval ratings? Because the Labor Department says the unemployment rate rose in 29 states in October. I mean, might this be the main factor dragging the president's approval rating?
I'm sure it absolutely has something to do with it. Pollsters are hearing all over the country that people are very concerned about the economy. And right now, this is why you're hearing Congress considering a second, they're not calling it a stimulus bill, but they're considering a second jobs bill, because that is a #1 concern. People are facing really hard economic times going into the holidays, especially. So that's something that they're taking a look at.
Okay. Let's talk about health care, because the Senate is certainly voting today on whether to put its bill up for debate on the floor. Its bill requires health insurance for all. It requires many large employers to cover employees, or else they're going to face a fine. Insurers cannot reject coverage based on pre-existing conditions, and the price tag for all this, $848 billion. What do you see as the bill's chances today?
Well, today is this procedural vote, essentially allowing the Senate to move forward with debate. I do think that that's probably going to happen. They don't for sure have all the votes yet, in part because Senator Mary Landrieu hasn't said what she's going to do today on the Senate floor. But I think that they're probably going to move forward. What ends up happening in the long run, I think we're a long way from knowing what this health care bill is exactly going to look like. The House passed their bill a few weeks ago, but there's still that key conference committee. If it does pass the Senate, they're going to have to merge these two bills and come up with some kind of compromise that liberals and conservative Democrats support. Maybe they can get 1 or 2 Republicans on board, maybe not.
I was going to say, you think this will go on down along party lines?
More than likely today, that's what it's looking like. You never know with Senator Olympia Snowe. She's a Maine Republican, and certainly she's getting a lot of pressure from people to help on this. But given the fact that this is a procedural vote with the party controlling the chamber, I think it's probably going to be a straight party line vote today.
Okay, Christina Bellantoni for Talking Points Memo. Thanks, Christina.
Thanks.